A PEG tube is a tube that goes into the stomach for feeding purposes. Some patients need a feeding tube in order to maintain good nutrition because they have trouble swallowing or are unable to get enough food through their mouths. Usually, the tube is temporary. The tube is placed as a same-day surgical procedure. You will receive intravenous sedation, but general anesthesia is usually not needed. A flexible tube or endoscope will be passed through your mouth into your stomach. The doctor will then be able to see inside of your stomach. A small half-inch incision is made through your skin and abdominal wall. The tube is placed through this and into your stomach. A balloon holds the tube inside the stomach. Another type of tubing has what looks like a mushroom plastic piece that holds it inside the stomach. Sutures are used to hold the stomach against the abdominal wall with T-fasteners. These are called bumpers or buttons. On the outside, there is a plastic disc or flange that goes around the tubing and is close to the skin. It should not be too tight to the skin. There will be 6 to 12 inches of tubing with a cap on the end. A dressing will be placed on the PEG site. Change this every day after cleaning the site and be sure to wash your hands first. Clean the site gently with soap and water while taking a shower or at the sink. If there is crusty drainage, but the skin is still intact, then you may use hydrogen peroxide on cotton swabs. Be sure to rinse with water afterwards. The tubing should be secured with tape. If you have the bumper type of T-fasteners on the skin, then they will need to be removed by the GI clinic 3 weeks later. If you have button types of T-fasteners, these are dissolvable sutures and should fall off after 3 to 4 weeks. You may turn them gently to help the process. If they do not fall off, then make an appointment in the GI clinic to have them removed. In order to prevent clogging, it's important to flush the tube at least twice daily. Use 60 milliliters of water that is room temperature. Flush before and after each feeding or liquid medication. A registered dietitian at Roswell Park Cancer Institute will recommend the type and amount of feeding you'll receive. Be sure to sit up during the feeding and at least 60 minutes afterward. When you have a PEG tube, you may still eat or drink by mouth, depending on your situation. You need to check with your doctor or provider to be sure. Wash the feeding syringe with soap and water to keep it clean. The PEG tube may be needed for a few months or a few years, depending on your situation. The tube may be replaced or removed in the clinic by a nurse practitioner without sedatives or anesthesia, and it's usually very well tolerated. Complications are not common. However, they may happen. Call the clinic if any of these occur. Bleeding that is continuous or excessive. Leakage at the site that has become worse. Clogging on the tube so that you can no longer use it. Pain at the PEG tube site that you would rate at 5 or more on a scale of 0 to 10. Signs of infection at the PEG tube site. This includes redness, warmth, swelling, foul-smelling tan or green drainage, or fever of 100.5 degrees Fahrenheit that lasts more than 24 hours. If the tube falls out, it must be replaced as soon as possible or the opening will close. You may rinse off the tube and place it into the opening if possible. Another endoscopy for PEG tube placement may be needed. If it falls out during normal business hours Monday through Friday, and you live in the Western New York area, then call the GI clinic and plan to come in. If it is not normal business hours, or you live more than 50 miles away, then go to the nearest emergency department. Call the GI clinic if you need to make an appointment afterwards. After you've had a standard PEG tube for at least a month, you may choose to have it replaced with a Mickey tube. This is a low-profile gastrostomy tube, meaning there is no extra tubing on the outside. There is a cap that covers the feeding port. Open the port by removing the cap. There is an anti-reflux valve inside that prevents stomach juices from flowing out. Attach the extension tubing by aligning the black line on the extension set with the black line on the feeding port. Then rotate it 1/4 turn. Keep the clamp on the extension tubing closed until you're ready to start your feeding. Attach the extension set to a catheter-tip syringe for bolus feeding. Water in feeding should be room temperature. Wash the extension set with warm soapy water and rinse with plain water after use. The extension set may be replaced every 1 to 2 weeks. The Mickey feeding tube does not need a dressing, but the site should be cleaned daily. Feel free to use soap and warm water. The Mickey feeding tube needs to be replaced every 4 months, or sooner if there's a problem. Please ask your nurse or provider if you have any further questions about the Mickey tube.